Every year, thousands of new cases of laryngeal cancer are diagnosed around the world. This is a serious, yet in many cases, preventable disease. If detected early, it's often possible to preserve both the voice and quality of life. In this video, we'll talk about the most common signs of throat cancer, its risk factors, how it develops, and why early action is so important. We'll also answer key questions. What are the early warning signs of throat cancer? Can voice changes be the first red flag? Is it true that late-stage cancer is often diagnosed too late simply because people ignored a persistent sore throat? What is laryngeal cancer? Laryngeal cancer is a malignant tumor that develops in the larynx, the area of the throat where the vocal cords are located and where sound is produced. It's a relatively rare type of cancer, making up about 2 to 3% of all cancer diagnoses globally. But it's one of the few cancers that often shows early symptoms, such as hoarseness or voice loss. Sadly, many people ignore these signs or delay seeing a doctor. That's why the disease is often diagnosed at a later stage when treatment becomes more difficult. Who is at risk? Men are about 4 to 5 times more likely to develop laryngeal cancer than women. This is mainly linked to lifestyle factors. Let's briefly go over the main causes of the disease. Smoking, especially strong tobacco and long-term use. Regular alcohol consumption. Chronic exposure to polluted air, dust, or chemical fumes. Long-term throat conditions or benign growths like papillomas or leukoplakia. People over 40, especially smokers or those working in hazardous environments, should pay close attention to any voice changes or ongoing throat symptoms. Early symptoms you shouldn't ignore. The earlier a tumor is found, the better the chances of a full recovery. That's why it's so important to recognize the warning signs. Here are the main ones. Persistent hoarseness or voice loss lasting more than 2 to 3 weeks. A lump in the throat feeling, tightness, or constant irritation. Chronic sore throat or pain while swallowing, especially on one side, and unresponsive to standard treatments. Difficulty swallowing dysphagia, such as needing water to swallow food, or the feeling that food is stuck. Bad breath, halitosis, not related to dental or stomach issues. These symptoms don't always mean cancer, but they do signal that something is wrong. See an ENT, ear, nose, and throat specialist to investigate further. Later symptoms that require urgent medical attention. Let's go over the signs that may suggest the disease has progressed to a more advanced stage. Coughing up blood, especially if it happens more than once. Shortness of breath or noisy breathing caused by the tumor narrowing the airway. A firm, fixed lump in the neck that doesn't go away. These symptoms may indicate that the tumor has grown or spread to nearby lymph nodes. Immediate medical evaluation is crucial. How is throat cancer treated? Treatment depends on the stage and exact location of the tumor. In early stages, stage 1, the disease is often fully treatable with surgery or radiation. In many cases, it's possible to preserve the vocal cords and the larynx. For more advanced stages, 2 to 3, treatment typically involves a combination of chemotherapy and radiation. This approach takes longer, but often delivers good results and may still preserve speech. In stage 4, the tumor may block the airway. In such cases, a tracheostomy, a surgical opening in the neck to help with breathing, may be needed, and sometimes the entire larynx must be removed. Even then, modern technology like voice prostheses can help patients speak again. Treatment has improved significantly over the past 10 to 15 years. Many patients now live full, active lives, especially when the cancer is found early. Prevention and long-term health. Laryngeal cancer can often be prevented. Here are important steps you can take. Quit smoking entirely and avoid secondhand smoke. Limit exposure to dust, chemicals, and polluted air. Get regular checkups if you're in a high-risk group. See a doctor if your voice changes or if a sore throat lasts more than 2 to 3 weeks. If you have chronic throat inflammation, don't ignore it. Get treated under a doctor's supervision. And if standard treatment isn't helping, ask for a referral to an oncologist who specializes in head and neck cancers. Throat cancer can be caught early. If you or someone you care about has persistent voice changes, throat pain, or trouble swallowing, don't wait. Early detection can save your voice and help avoid major surgery. If this video helps even one person catch the disease early, it was worth making. Share this video with your loved ones, and if you have questions, leave them in the comments. We'll respond or make a follow-up video on this topic. Take care of your health and your voice.